All right, and then on top of it, we're dealing with the stigma of mental health that, especially in our Black community, that we don't talk about it. It's taboo. In our Haitian community, we don't talk about it at all. So now that we are dealing with all these issues, how can we as a community talk to, because it said 63% of Blacks see mental health as a weakness, or they rather go and speak to their pastor or loved one instead of seek mental health care. So how do we as a community communicate how important it is that if they're having a mental health issue, that it's good to go speak with someone?
Well, yes, that's a good point. Education. Education, I think, is the key. Education to counter the needs and the stereotypes about mental health. We live in an era where people put other people down because they're different. And the way we combat that is through education. As professionals, what we do, we're teachers. We educate our clients, but we educate the community as a whole in what mental health is, how we can cope with it, but also show them that there's a future in mental health. There's a future after depression. There's a future after anxiety disorders. People can cope, people can live normal lives. People can be successful after depression. By the way, I just want to give a little statistic. About 20%, since COVID started, 20% of the population, sorry, I'm getting this number backwards. Depression has increased about 25% since COVID. And anxiety disorders about 25 to 27%. So we educate the population. We know for a fact that we have had politicians that have suffered from depression. We have had many actors that have suffered from bipolar disorder. CEOs.
Yeah.
And they're very successful, they're living normal lives. So it can be done, it has been done.
You spoke something about the church, and I think part of the educational piece is that we need to go into the churches and inform the pastors in that church culture how therapy and counseling is not antagonistic to their religious practice, because there's this, I guess, some fear in some churches that if someone goes to therapy, then they're going to lose their church member. And so a lot of people feel like they can't go to therapy or counseling or seek that kind of help because the church has said that they shouldn't. So there needs to be some real deep down work within the church culture to kind of, because they perpetuate some of the stigmas that are attached to it. And that's I think if we go top down, that will help. And I would like to also add, outside of education, is having people share their stories. I think a lot of times we're very silent about our journeys. And again, oftentimes we talk about getting services from a space of a very right side, like extreme, like I've been diagnosed. But there are people who might be suffering from something that's not so extreme, who still need therapy and counseling. And more people need to hear about how therapy and counseling benefited them so that people can understand, because I don't think a lot of people know why they should get those types of services.
And thank you for opening up for me. I was diagnosed with a mental health disorder. I was diagnosed with post-traumatic stress disorder. And I share that freely because it allows others to see that although you may have had a diagnosis of something, that doesn't mean that becomes you all for the rest of your life. And it also helped me in the therapy sessions to share that story with some of my clients, to get them to see that it is okay to be okay. It is okay. You can get better. These are the things that I had to do, and I stuck to the treatment regimen, and I did the talk therapy, and then when I had to take medication, I did take the medication, never knowing that one day I would become a licensed clinician. I was speaking to someone across the couch from me. So I think it is very important to share those lived experiences with others, to normalize it and where it's not so taboo, but it can happen to anyone, you know, so, yeah.
we certainly want to give them a chance to talk a little bit about it, because I'm feeling a sense of hope with this generation, because, you know, I see, because while we are seeing an increased rate of issues, but I see your generation saying, hey, I need some help, right?
So, speaking from the youth perspective, I feel like we should increase more mental health presence in schools, because students feel as if they shouldn't go to a mental health counselor because, you know, it's not needed, or it even starts from home. Like me, I know personally, if I tell like one of my parents, oh, I'm depressed, they'll be like, oh, you have no reason to be depressed because you have a roof over your head, you have AC in the house, you have food in the house, you know what I mean? But increasing more mental health counselors in schools would be able to help students feel more comfortable and more, you know, willing to actually talk about their problems. And I also agree with what you said with education, you know, educating them on that it's okay to, you know, go to the counselor and like express your feelings instead of just holding everything in and then, you know, lashing out when, you know, when everything just builds up.
Absolutely, absolutely. And so you certainly sending out the message today that it's okay to go, right? Even though mom may say that it's not, you know, like, no, you're not, you have all of those other things, but the person can still, and it still is okay for us to say that I'm not feeling good, right? And that's okay. So awesome, awesome.
It's okay not to be okay. And then one point that Jonathan made, and I was reading, the millennials, they go online and they identify with stories. They connect better when you tell the story, and then they're more likely to follow up and get mental health care if needed.
Yeah. And let me tell you, let's be really honest, right? Because we are living in a society, let's really understand this, where one can be dealing with all kinds of stuff, and somebody told us that we couldn't talk about it.
Yeah.
Right? And this is the message that we receive, like historically, that we can go through all kinds of stuff. Slavery, colonizations, and things that are happening, but people say don't talk about it. So we've internalized that, right? And so now we're saying, let's talk about it, right? So if I'm not feeling good, I show up at UM and I say, I ain't good, I'm not feeling good. They're like, what's going on? I'm like, George Floyd died. You know, like, you know, we just have to be honest, and I think we have to be able to say, this is what's going on. The more we do that, the more that everybody will understand that this is important for us in terms of our mind. Because our mind is the best asset that we have, right? And so we have to be able to protect it. So I love the summary. My job is just to summarize everything you guys said, right? It's to summarize that absolutely sharing stories is important. Tell somebody what you're feeling. Tell somebody what your experiences are, right? Really making sure that we talk about the importance of therapy. What is it? Right? What happens in the space when I call Guerda and I need to see her? What is that about? Right? Being able to have mental health in school. My goodness, do all of you remember we used to have a counselor in school a long time ago? We used to have it in school, right? But we remove it, and you saying that means let's bring it back. Okay, let's bring it back onto the school, which is really important. And of course, the importance of education as well. So, awesome points, awesome points.
All right, so my job will be to ask a question.
Yeah, yeah, that's it. Yeah.
All right, well, we discussed and we know that we're focusing on mental wellness. But of course, when a family member have a loved one and they're not being themselves, they're showing some symptoms, that, you know. So what can family members look for, friends look for, of the changes that can show that that person is suffering of depression or anxiety, like clinical symptoms?
Okay, well, let's talk a little bit about what depression is and what depression is not. Depression is not the same as sadness. Sadness can be involved in depression, but depression is a syndrome. It's a complex condition that involves sadness, feelings of hopelessness, feelings of helplessness, anhedonia, which is the lack of pleasure in things that we used to enjoy before, isolation maybe, disturbance of sleep, disturbance of appetite, meaning that we eat too much or we don't eat, or we sleep too much or we don't. Eventually, give it time, if it goes untreated, you may end up with thoughts of hurting yourself, suicide. So it is very important. It is very important that we deal with this. Identifying symptoms, identifying changes in family members, especially kids, children. One of the red flags is behavioral problems in school for kids. Okay? The child that used to be, quote unquote, the model child in school, now suddenly he's talking back to the teacher, he's pushing other kids, He's killing people, he's using foul language, and so on and so forth. Isolation is another one. But many kids do also show irritability and aggression. And sometimes they talk about not wanting to leave continually. So we need to pay close attention to these things. It is our role as fathers and as professionals to be observant of those things, to be mindful of those things, and to allow kids to talk without being judgmental about what's going on with them. Otherwise, they would shut down and we will not know what's going on. In order for us to help, we need to know what's going on.
Yes, I totally agree with it. I feel like you should actually check up on your loved one, and notice the little small details that's, changing with their personality. If they usually eat a lot and they're eating less, or if the person is usually more joyful and they're beginning to stray away from that and become more distant. And also create a space where we, as family members, we create a space where they're comfortable enough to come to us and able to talk to us, or have other family members come to them and show them that they support them, that they're loved.
I don't know what else to say. I mean, they basically covered it all. But one thing we do have to become is very supportive. When people are experiencing depression, and especially if it's clinical depression, they may call out sick from work. They may say they want to do something one minute, and the next minute they could say, I don't want to go anymore. And that could create havoc on relationships. It could create havoc within the family. It could create stress on the job. And so to be understanding as you can be, and to support that person even while they're going through the depression. Maybe encourage them or take them to the doctor so they could get a medical checkup. And the doctor may also refer them out to get a psychiatric examination or something like that, but just to support people. We may not understand it, you may not understand it, but to tear them down, to criticize them, you always act like that, just pray it away. You're not praying hard enough, and that does not help. Making a person feel guilty and shame never helps anything, never changes anything. It only makes it worse. So support is very important to anyone that is experiencing changes within their life.
Definitely. And certainly don't tell them, get over it. You hear that a lot. And checking on our friends that look so happy or have it together too, because we have high functioning depression. And you want to elaborate on that?
I was going to say, a lot of times I feel when I look into the minority community, we're functionally depressed, where we're still, we have no choice but to show up in the world, because we know it means that we need to survive, and that often it goes under the radar, because the symptoms that he just said might be there, but we still are showing up to work every day and doing the things that we're supposed to do, because we know if we don't, the things are just going to, the feelings that we're feeling will only get worse, because our life will be more in shambles. And so that's something I think we don't talk enough of, is what functional depression looks like. Because I know I have been functionally depressed, where I'm like showing up, hey, how you doing? I'm great. But inside I'm just like, I just want to go in a corner and cry right now. So
I just wanted to add, and you talk about feeling guilty, getting people down. I think families are guilty of that as well, because they're not educated on what depression is. Sometimes they will label their loved one as paresseux, when in fact the person is suffering from depression, lack of energy, lack of motivation. Those are some of the symptoms of depression. It's not that person is purposely.
There's a change. And that's what we're paying attention to. There's a change in this person. So I see you, Jean, and we've been here, every time I see you and the way you look, but today you look different. And even though I say we have a thing in our community, we say, how are you? I actually think we should actually stop saying that. Because now everybody say, how are you? And the answer is, I'm fine. And are you fine? No, you're not. And you're not fine, but we still say, I'm fine, right? Overall. But so the piece of making sure that we're paying attention to the change in the person's behavior is really, really an important sign that you mentioned. Like, how do I pay attention to that? The other piece I think is really key is that somebody who's depressed, who's anxious, right? And who's not sleeping and not eating well, don't necessarily want that life. That's not what they want for themselves. And that's important to remember that. So when we think it must be the person is causing this family because then they came on the vacation or something's happening, there's a family event and this person is behaving a particular way, and then we're so quick to blame the person, right, for it. But the person, it doesn't want to live like this. And it's remembering that and putting ourselves in the shoes of the person who's experiencing it allows you the opportunity to say, what if it was me? How would I want to be supported? How would I want to be treated, right, in this particular way? And I think that will help us, have a little bit of an edge, a little bit of an edge in terms of that, yeah.
Definitely. Thank you, Dr. Guerda Nicolas. And well, my next question, since I'm asking the questions, Caesar brought an important point as far as having more counselors into the schools. But we know there's only 3%, about 3% of mental health providers, to serve our communities in the United States. So it's been very difficult to find someone, because sometimes we would like to see somebody that we can identify to, somebody that understands our culture. So I know you're going into psychology? All right.
Okay now.
Yes.
Okay.
So how can you help young people like yourself, encourage them to enter the field of mental health?
That's a really hard question because you can't, I can't, just make people just want to go into the field. How to encourage them, just educating them on what mental health is, and if they resonate with everything that's going on, they will resonate because mental health is a universal thing. And, if they want to, chase a career path towards mental health, then that will be on them,
Well, thank you. And Nzingah, I know that you have a story to share with us because I know with your mom and when she was diagnosed and the difference it could have made if somebody understood that culture. Would you like to share that with us?
Okay, yeah, sure. So I am Haitian American, and growing up I would always hear your mom gets sick sometimes. As a child, that sounds like, she gets a bellyache sometimes, so on and so forth, and then she had a manic episode, and that's when I was clear, there's something else here. It took us a while, because you were saying some of the things to help people. We didn't know what a Baker Act was in 1992 when it happened. So the police came a couple of times, and once they saw a pattern, then my mother was Baker Acted. So Baker Act is when willingly or unwillingly someone will then be placed in a mental institution. I will say we were fortunate because we were very well insured that we took my mom out of a public mental institution into a private one, and that made a big difference in her care and her diagnosis. So I definitely say we were privileged in that kind of way because not everyone can do that. And as a result of us being in a private institution and they knew that there were children in the household who was exposed to some trauma, they did group therapy. But group therapy was insufficient. As an adult, I can say it wasn't what my brothers and I needed. Because it was a Haitian household, I ended up being the translator, default as firstborn. So I didn't get to speak on the things that I was feeling. I was translating for my grandmother, and they were getting they were understanding that this wasn't the first time, but my mom had a history of mental illness from Haiti. And that they were so, I could, as a translator, again, being firstborn, firstborn, you're more aware of things as a child than you should be, and that's a whole different conversation. But I knew what I was translating they were perplexed by because they didn't understand Haitian culture. And so instead of having a group session that really got to the nook and cranny of the needs that we needed at that moment, they were kind of like, what do you mean someone did something to your mom? Because in Haitian culture, oftentimes mental illness is always associated with voodoo. Someone did some magic on someone and that's why. And they were just kind of like, what are you talking about? That doesn't make any sense. Blah, 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 so on and so forth. And so it was challenging for my mom to get the support she needed until she got her Black Haitian psychiatrist. She felt seen. He wasn't just focused on giving her medication. He was really engaged in having her have talk therapy. And because he could speak her language, he could speak to her in a way that the other physicians before and after could never speak to her. And that was the moment that I saw her thrive. Futuristically, that's not necessarily what I saw. Honestly, I shared it during our call. My mom was not diagnosed properly, and her symptoms were dismissed as an episode, and she ended up having a stroke that went undiagnosed, and now she has significant brain trauma. She has global aphasia, and it's changed her life forever. But when we had someone who looked like her, who understood the culture, they didn't get caught up in the nuances of voodoo. Oh, someone you felt. You know, they were like, okay, we know what that is. Let's talk. Let's unpack. Let's talk about your trauma. Because underneath this voodoo story, there was trauma. And so that's why, for me, I'm really big on finding people who understand the culture. And I know it's hard. Like you said, the numbers aren't great. But it's so important that we have more people in this field, because then they can help support not just the individual, the family. Because when we talk about mental illness, no one ever talks about the impact it has on the family. Not just during the episodes, forever.
Anything else anybody wanted to add to that?
It is important as therapists that we work within the culture of the individual that we're treating. If you don't understand the culture, it's difficult to understand the root cause of the condition. Haitians, as most of us are, do believe in dark fate. We believe that life itself impacts us in different ways. And as therapists, we need to understand that and identify those cultural mood signs and work within them. People look at us the wrong way, they're doing something to us behind our back, all kind of stuff. But under that, there's always another thing going on. And as a therapist, it's very important that we work and understand where those thoughts and emotions are coming from, so we can treat the person.
I would like to piggyback on that too. So if you have a client that says someone put voodoo on them, we don't tell them, no, they did not.
Yeah.
You know, help me understand what that means.
Exactly.
And let them tell you the story. And then you see how you can work within the framework of that story. It's not our job as clinicians to come and tell someone what they can't believe in or what is not true, even if you don't agree with it. It is to support the client through the process at all times. That helps you to stay relevant to their needs and not your training or your own needs. We have to stay focused and present to their needs. So if it's voodoo to them, that's what we go with.